Muted.
Good afternoon, everyone. This is Evelyn Mantilla coming to you from Access Health Connecticut. Welcome to today's webinar. I want to walk you through a couple of housekeeping items. The first one is, well, first and foremost, we should always say thank you for participating. We're really glad that you're here. It looks like we have a good number of participants. And so here are some of the items for housekeeping. Please know that participants are automatically muted once logged in. Keep your audio muted for the duration of the webinar. That helps us keep the webinar running smoothly, so I really appreciate it. Questions will be reserved for the end of the webinar. What I need you to do when you have a question is on the bottom right-hand side of your control panel, there is a chat functionality where you can type in your question, and at the time for questions and answers, we will address your question one at a time. If you find your audio component is experiencing any technical difficulties, or you wish to call instead of using your computer's audio components, switch from audio to phone call in the control panel. And this will give you a phone number and an access code to dial in and listen to the webinar. So with that, let's get started. I am happy to introduce you in a moment to Andrea Ravage, who is the Marketing and Sales Director of Access Health Connecticut, as well as Alexandra Dowe. Thank you, I apologize. Alexandra Dowe, Policy Analyst with Access Health Connecticut. As you know, today we're going to talk about immigrant eligibility, enrollment, and outreach. The agenda for today. Why did I miss the agenda? My apologies. We're going to talk about, Okay, very good. The agenda for today is going to go like this. First, we're going to talk about immigrant eligibility. Item number 2 will be immigrant enrollment. Item number 3 will be immigrant outreach. And of course, we'll follow that by talking about opportunities for you and your organizations to enter in partnership with Access Health Connecticut. And as I mentioned to you before, at the end, we will have time for questions. I'm going to go back on my slides, just one slide, because we wanted to make a point of highlighting the open enrollment information before we move into the webinar. So I want for you to see in this slide that open enrollment begins on November 1st of this year, and it ends on January 31st of 2017. However, it's also very important to understand that December 15th of this year is the deadline to enroll if you want to make sure that your insurance is effective on January 17th. So with that, let's get started with the webinar. And I'll hand it over on immigrant eligibility.
Okay. This is Alexandra Dowe. I'm Policy Analyst at Access Health. So this morning, or afternoon, I should say, we're going to talk about, we're going to begin with immigrant eligibility and start with the question of who's eligible for coverage with Access Health. So our individual and family plans are available to Connecticut residents who are lawfully present and will be lawfully present for the rest of the plan year. And as you can see, lawfully present people are U.S. citizens by birth or naturalization who have a valid current U.S. immigration status or who are not currently in prison or in jail. And, you know, one of the things I know that in our customer service department and our outreach that we try to emphasize is that as an organization, we understand that individuals and families can have any combination of lawful present statuses, and we're going to get into some of the different types of immigration status that are eligible, and then some of the other documents that you can use to verify that. So we understand that lawful presence is not the most straightforward concept, and we emphasize that we're here to sort of provide more resources to clarify how that works and how the process goes. Next slide. So here we have 4 important things to know about eligibility. immigrant eligibility. The first being that immigration information provided on the health application that you either are filling out for yourself or are assisting people filling out will be used only to verify eligibility for coverage. So the U.S. Immigration and Customs Enforcement Department has stated it will not use this information for immigration enforcement purposes. And again, this is a message that we try for, especially for access purposes, to be sure that people understand that this is about their health care first and foremost, and that they shouldn't allow any fear of any kind of enforcement or adverse action to impact their decision to apply. The second is signing up for insurance through Access Health Connecticut or Husky Health does not make someone a public charge. The one exception is for people receiving long-term care in an institution at government expense. The third thing to know, undocumented immigrants are not eligible for coverage, but they can apply on behalf of their eligible dependents. Those who are not applying for coverage themselves will not be asked about their immigration status. So they should keep that in mind when filling out the application and seeing those questions, that it's not necessary that they offer that information if they are just applying for their eligible dependents. And then fourth, it is important to have immigration documents ready when enrolling for coverage, and we'll talk a little bit more about the documents that can be used in order to complete the application and then later to verify that information should there be any inconsistency with what the Federal Data Sharing Hub shares with us. So I won't get into the nitty-gritty of each of these statuses and what they mean, because this will be all available as a resource later, but the next couple of slides give an explanation of the types of immigration statuses that are eligible for Access Health. They include lawful permanent resident, refugee or asylee, humanitarian immigrant, and then on the next slide there are a couple other types there that are recognized, and then what it actually means. And it's important to keep in mind that our description of what this means is also going to be part of what it means to verify any status this way. So we can go to the next one. So immigrant eligibility for Husky Health. In order to qualify, this is probably the largest message that we try to get out to people, is that they understand that in order to qualify for Medicaid, so either the Husky A or Husky D program, and the CHIP program or Husky B, most individuals who fall into any of the categories listed above on the previous slides, I believe, or excuse me, any of those programs that are listed will need to meet a 5-year residency requirement. So they will have to either have that particular status or that type of status that we went over in the previous slides, or some combination of those statuses for at least 5 years. And then following on this slide, there's a list of the individuals that are exempt from that 5-year residency requirement. So as I said in the beginning, as an organization, we recognize that immigrant families, it can be a wide range of statuses, and that they are often mixed status families. And in order to try to make things a little bit easier and more streamlined, we allow mixed status families to use the same application to apply for advanced premium tax credits and cost sharing reductions through Access Health, or to apply for Husky Health. Our system is a integrated system between our qualified health plan offerings and the Medicaid offerings from the state. Family members who aren't applying for health coverage for themselves will not be asked about their immigration status, as I said before. And individuals cannot be denied coverage because a family member or household member who is not applying has not provided his or her immigration status. And this, again, this is an access provision so that we are able to allow the most robust selection of options to those who do have qualifying immigration statuses. So Undocumented immigrants are not eligible to obtain health coverage through Access Health Connecticut, but they can purchase coverage on their own outside of the marketplace. And I did do a little bit of research before because I wanted to make sure that it's clear that carriers, there is the possibility that carriers offer plans, a range of plans or a range of options, and it can vary from carrier to carrier in Connecticut. So it's important that if you're either working with an undocumented immigrant who's looking for guidance on something like that, you know, they cannot buy on the marketplace, but they with that said, should also be aware that the options do vary from carrier to carrier. So it's not as easy as you can go to this carrier and buy here. And I think that that's important to note. And undocumented immigrants are eligible for an exemption from the individual shared responsibility requirement. So they will not be subject to the tax penalty. And the Affordable Care Act has a few different types of exemptions built into it. Some of them you're required to apply for through the exchange here at Access Health, but this particular exemption for undocumented immigrants, if they are filing taxes, comes from the IRS. And community health centers are also always an option and will provide health coverage to all residents in their service areas. So next we're going to talk a little bit about immigrant enrollment. We'll start with the enrollment channels. So they're just as available to everyone as everyone else, I should say. Online, our website is available 24/7 to provide guidance and tools and services to help people enroll, and our website is listed there. We do have a full-time call center to answer any questions consumers have and help them enroll over the phone, and our phone number is there as well. We have a wide range of in-person options. Brokers and certified application counselors are available year-round to provide enrollment assistance. And even during open enrollment, Access Health opens additional locations for in-person help. And all of our assistance from Access Health and our partners is free. We offer assistance in multiple languages. The accesshealthct.com website, including the full application to enroll, and our Learn More site is available in Spanish. Well, you can go to the next slide. Help is available in over 30 languages through our call center, and our enrollment centers can provide in-person assistance in Spanish. Brokers and certified application counselors do provide assistance in many languages, and I did want to note that there were new provisions that came down about non-discrimination and taglines on our website. So there are new language resources available that I think that we have 10 languages right now, 13, okay. The top 13 languages in Connecticut, so that people can find their language on our website, and it will direct them to either our call center, our language services, so that they can get information in their language. Do the next slide. So these are just a couple tips for navigating the application process. It's important for those who are requesting coverage to complete all the relevant immigration fields in our application. And even if a field is labeled optional, again, for those members of the family who are requesting coverage, entering all of the information does really help the application go faster. It ensures an accurate eligibility determination, and it can help prevent the consumer from needing to verify his or her identity later on. And the next few slides do give examples of documents that would be very useful to enroll, if we want to go to the next one. And again, I won't get into the particulars about each one, but these are just some document level standards for what you would need when you're applying for each type of document. And then it's also important to note that if there is, and I think that we're going to get into verification, but if there is an inconsistency, these documents can also be used to verify any of the applicable immigration statuses. I want to go through the next couple. And then the next one. So a few more notes about disclosing immigration status. The application will only ask for information needed to determine eligibility for health coverage. Disclosure.
Okay. Oh. Yes, thank goodness.
Hi, this is Evelyn Mantilla again. Our apologies.
Let me
to have a technical difficulty with our audio, and we will definitely continue our webinar. I am hoping that everyone can hear me. If you could indicate so by type a quick note on the chat box for me. Can everyone hear me?
Yes. Yes.
muted. Huh.
Good afternoon, everyone. Our sincere apologies for the technical difficulties. We should be back where everyone can hear me, whether you are on your audio component from your computer or on the phone. So with that, let's pick up where we left off, where we were talking about disclosing immigration status.
Yep, so just to pick up there, the application will only ask for information needed to determine eligibility for health coverage. Disclosure of a social security number for a person not seeking coverage for themselves must be voluntary and used only to determine eligibility for an applicant or beneficiary. And I think here it's important to note that in the field where the social security number is asked for, you can leave it blank, or there is a drop down with I believe you can leave it blank, and then there is a drop down with selections about why you have not offered a social security number, things like that. So there are some sort of technical options, but there are options specific to immigration status, such as not eligible for a social security number, or I think there's also certain applying for certain visa statuses, things like that. So we did try to capture those different levels so that people can be as thorough as possible when talking about their social security number in our application. Information provided by applicants will not be used for immigration enforcement purposes, and individuals will not be denied coverage because a family member or a household member who is not applying has provided his or her immigration status. So again, if an individual is not applying but is applying for their dependents or their household members cannot be denied because that individual who is not requesting coverage maybe does not have a qualifying immigration status. So in order to verify identity and immigration status attestations that we receive through our application. There can be some issues that we run into, and we do ask consumers to get involved in that process by providing us with documentation that can verify. So identity verification issues occur when information on the application doesn't match our data from our trusted sources. Most common types of identity verification issues are related to income, citizenship, and immigration status. So our consumers can find out if they have an identity verification issue by checking the eligibility notice that they receive from Access Health after they have submitted their application. And consumers are encouraged to read their eligibility notices carefully and be sure that they've submitted all the information that is requested, that the correct document or combination of documents, if applicable, has been submitted, and information for the correct number or numbers of the household are also consistent on the application. Consumers who don't submit additional information about their specific issue risk changes to their financial health and or eligibility for coverage through Access Health. And we are very persistent, I should say, about sending warning notices to make consumers aware that their eligibility will be adjusted, or there's the possibility that their coverage could be terminated, or possibility that their financial health could be terminated. There's a couple different combinations of things that can happen if we encounter an unresolved verification issue, but consumers do have a reasonable opportunity period to verify their information, and we attempt to provide with them in notice form, usually with the most information possible about what's expected from them in order to verify that information. Identity verification issues for Medicaid and CHIP individuals are resolved by the Department of Social Services.
Now we're going to begin to have a conversation with you about Immigrant Outreach and in particular what Access Health Connecticut has established to be able to reach this very important community in our state. And I'm happy to pass it right along to Andrea Ravage, the Director of Marketing and Sales.
Thank you, Evelyn, and thank you, everybody, for joining us this afternoon. We are very excited to bring this very important topic and one of our top priorities as an organization, as we have a book of business that is extremely diverse. And from a marketing and outreach perspective, this community has been top of mind. And one of the things that we have been trying to do for the past couple of years has been to think outside the box of where can we find people that go through the process of becoming a citizen, a resident, people that seek work permits, student visas, and et cetera. So one of the things that we started doing this past year was to start looking into naturalization ceremonies. And when we first started this journey was back in 2013, and we got a lot of closed doors. And we were able to talk to the right people that allowed us to not only be at every single naturalization ceremony in Connecticut, but also to be able to speak to the ones in Hartford. And if you're thinking, why just Hartford? Well, this is kind of like a pilot program for us right now. And in the future, we are trying to expand that to Bridgeport and New Haven and others around the state. But one of the things that really caught our attention was the amount of people that become citizens in this specific state. And we were talking about numbers that were in the excess of 15,000 during a year. And this is a great opportunity for us to tell them about not only this big change that they're going through, but also the all the benefits that they're gaining as U.S. citizens. And one of them, of course, is healthcare. And we also, try to get into their minds that healthcare is not just a benefit, that it's their right and it's their family's right to be able to get it. So this is a great opportunity for us to hand out flyers, talk to them, answer any type of questions. And on the screen, you can see one of the piece of collateral that we created to be able to communicate, some of the things that not only from an eligibility perspective, but a lot of them come with their families. And a lot of those families are mixed families or people that are seeking some type of documentation here in the state. So this is a great opportunity to go through every single category that not only includes becoming a resident or a citizen, but there's many other categories where people can still get healthcare coverage. So I encourage each and every one of you to really look at this document and look at the information, because it really gives a very detailed description of every single category where people can be able to purchase any type of insurance. On the next slide, it just shows you a couple of pictures of our interaction during the naturalization ceremonies. And for those of you on the phone that have been to any of these are very special ceremonies, not only from the fact that people become citizens, but also the fact that they get to share this with their families. I actually personally went through one last month, I believe, and one of my favorite stories, which I actually didn't even share with Evelyn, was that the person behind me that was becoming a citizen hugged her husband, and I'm getting the chills right now, and she said, "Honey, we're free." And that, to me, it was really the meaning of what these ceremonies are and the importance of us being present during that important time. And not only that, but being able to provide them such important information that will really change their lives and their families. Additional to that, we have been doing a lot of outreach in communities around the state. And, you know, when we're doing outreach in our state, we don't see differences in ethnicities and cultural backgrounds. Everybody is entitled to having this benefit, whether they are able to buy it right now or they buy it in the future. It's really about informing them of their options. And so we have been going around the state to have presence. And you might think, what is Access Health doing outside of open enrollment? And one of the biggest things is to start talking to people about plan utilization and really making them understand that it's not just about enrolling, it's about making sure that they're seeing and feeling the value of what they bought. So one of the things that we are asking everybody is we're always open to suggestions for events around the state. So if you have any events, whether it's a group that you belong to or your organization, by all means, please reach out to us, and we will be more than happy to share what we could potentially do. And this is a good segue to asking, because this is kind of we need you to be able to be successful. And for the past 4 years almost, we have been really lucky to be working with extremely dedicated community partners that allows us to go deep into their communities. One of the biggest challenges that we had the first year was that we didn't have anything to start with. There was no model to follow. It was try a little bit of everything. But now we have almost 4 years under our belts, where with our partnerships, we have been able to develop very robust outreach events and webinars like this, where a lot of our community partners have asked us, this is a problem in our community, we want to understand how we can help our community. And in this case, a lot of you deal with immigrants, and we want to make sure that they understand that they have rights, that the only thing that they need to have in this case is to be lawfully present in the state. And Allie and I were having this conversation yesterday, because this is a gray area where a lot of people ask, what does that really even mean? And a lot of the times people just think, well, you have to be a U.S. citizen or a resident to be able to apply, otherwise you can't. And that is not the case. So again, going back to that piece of collateral that we saw about 3 slides before, please go ahead and read every single one of those categories, because a lot of people qualify outside of having a green card or having a citizenship. So we have put together a very comprehensive community partner website, and you have the URL, learn.accesshealthct.com/community. And this is a page that we purposely built to be able to communicate with you and be able to provide collateral, marketing materials, information that will affect you and your community. So please feel free to visit us. Please feel free to sign up for our email list so that you are up to date with our newsletters. And we're very excited to be announcing our first annual community conference that will be coming on October the 13th at the Ravitz Hotel in Cromwell. And one of the reasons why we wanted to make this such a big deal is this is the way that we materialize our commitment to all of you. And you might be thinking, what can we expect from a community conference? So a lot of the people that are on the phone or that have become community partners are influencers, are leaders in their communities, and a lot of people go to you for advice. So the conference is meant to provide you with tools to better serve your communities, how to guide them to the right resources, and ultimately, we have a lot of people that get certification to be able to enroll people. So this will be a very comprehensive conference that will happen a month, almost 15 days before open enrollment. We are very excited to be presenting the agenda very soon with key speakers that will really be able to talk about a variety of topics that are very, very interesting. So more to come on that, but again, once again, October the 13th, community conference. On the next slide, you're going to be looking at some materials that we have been building just based on things that we have been listening on the ground, really. Topics that people want to learn about. Immigration has always been very, very important to us. And so we have been able to build a lot of our collateral and marketing materials in both English and Spanish to be able to provide our community partners, our members, a good way and an easy way to understand this complex process. So I invite you once again to go to our community page at learn.accesshealthct.com/community, where you can find all of those. And we have been working for the past couple of weeks, working on updating a lot of these for the upcoming open enrollment. Once again, on the next slide, invite us to your events. We are happy to go and talk to your communities, and we have been doing this for the past 4 years, but our commitment to outreach has been growing dramatically to now we have probably the only exchange in the country that is allocating budget for a year-round outreach program. And that is once again a proof of how important we think working with our community partners and making sure that we're on the ground talking to people is. So again, invite us to your events. We are very excited to be able to be part of your communities. And that, just to end this webinar, you don't just have to go and get information from us. Become a partner. Become a different source for us to go and talk to your community. And what does that mean? Well, that means that we have your contact information. We have, what type of community do you serve, so that we're able to provide you with what you need. So again, this is an invitation to not just be listening today, but become part of this amazing, amazing work that we're doing. So once again, I would like to end saying thank you so much to each and every one of you for your work, your dedication, and hopefully this won't be the last time that we hear from you.
Thank you, Andrea. Thank you so much. I really hope that all of our participants have been able to get new information, interesting information about this very important topic. And so I would like to now turn over to our question and answer session. And I'm excited to say that almost from the beginning of the webinar, folks have been posting a couple of questions. And let me go to one. Actually, the simplest one is asking whether this presentation will be sent to you so that you can use it as a reference for anyone else that might have not attended. And the answer to that, I'll say myself, is an absolute yes. We will be distributing this presentation back to you. It is also being recorded and will eventually be posted for community partners to be able to view as well. So definitely you will see this presentation sent to you. The next question that I have, folks are asking, there's actually a couple of questions about the same issue, asking whether or not we were going to discuss issues in terms of coverage for DACA recipients. And for that, I think I'm going to move it over to Allie.
So the deferred action for childhood arrivals status is actually an exception to under normal immigration, acceptable or eligible immigration statuses, deferred action status is an acceptable immigration status for purchasing on the exchange. However, there is an exception for the deferred action for childhood arrivals or DACA population. But a couple of slides earlier, we talked about the exemption for the individual mandate or the individual shared responsibility payment. So in the event that there are any concerns about filing taxes or being responsible for that shared payment, anyone with a DACA status can apply for an exemption on their taxes using Form 8965. And there is some technical stuff about that, but I believe it's code C or something like that. But in the instructions, you can see that all of that information is available for the individual shared responsibility payment portion of the taxes. So that it is an exempt status from that particular requirement, but they still cannot purchase on the exchange.
All right, great. Thank you so much, Allie. I really appreciate your answer to that question. And let's see what else we have here. Here's an interesting question from Juana Llanes about how do you prove that you're a victim of trafficking?
That's a very, very good question. And you know, we talked about this under a couple different circumstances. These kind of very sensitive, especially when it comes to trafficking or it comes to domestic abuse and things like that. How do we deal with those types of sensitive situations? And our customer service department is equipped with the ability to bring those types of situations to our department for review. But as far as verifying that information, I don't know what the exact documents would be. But we can definitely take that back, because I imagine that there have been scenarios nationwide, and those are some lessons that we can learn here in Connecticut. So that's a very good question.
Terrific. So we'll certainly look at that.
Yep.
The next question I have, I think will be appropriate for Andrea to answer. It says, do you have representatives that speak any other languages besides Spanish?
Yes, the answer to that is yes. Most of our materials are only in English and Spanish. However, if you call our call center, there's over 100 languages spoken. Now, having said this, what happens to a lot of the people that need, in-person assistance? Our brokers speak various languages. Our enrollment specialists around the states speak different languages. So if you go to accesshealthct.com and click on the link that says Get Help, you can include some information such as the city or the zip code, and a list of all the people in the surroundings from that information will appear. And in most cases, it will tell you if the person speaks other languages. But I think that the easiest thing, if people are used to just that telephonic, conversation, is to go to to call our call center and request a different language right then and there. But it's over 100 languages.
Terrific. Thank you, Andrea. More questions. I'm really thrilled that people are asking them, so that this makes it such a rich conversation. The next question I have is, if you have a Social Security number for work only, can you apply for insurance through Access Health Connecticut?
So, and you can jump in, okay, because this is something that happens to a lot of people. Social Security numbers are not given to anybody that it's not lawfully present. So they have to have a visa, a green card, any type of permit to be able to be in the country legally, but Social Security numbers are only given to those lawfully present. So if you have a Social Security number, you're able to apply through Access Health Connecticut.
Great. Thank you. Thank you. Trying to keep up with all of the questions here. Will a low-income undocumented pregnant immigrant be eligible for Access Health Connecticut?
If the person is undocumented, they are not eligible for coverage. It doesn't, unfortunately, this is something that, and Allie and I were talking about this, because other states, we know of one, California, that has been fighting for this, to be able to pass legislation, to be able to offer healthcare coverage to undocumented individuals. and this just happened in June. We are trying to see how that goes and evaluate if this is something that we could potentially implement in the future in Access Health Connecticut. But for the time being, let me stress that if the person is not lawfully present, they cannot buy health care coverage.
Understood. Terrific. Thank you. Thank you. I have someone asking for a little bit more clarity, and let's see what we can do for this. Can you clarify if victims of trafficking need to have an actual immigration status?
I think, and if my understanding is correct, is that if you are a victim of a human trafficking unfortunate event or something to that effect, that is, I don't want to say a replacement for your immigration status, but I think in the United States, if you are a victim of something like that, you are recognized as having a qualifying status here in the country to be able to purchase health insurance. I don't know if that is enough clarification, but I don't want to say it's in the absence of an immigration of a qualifying immigration status, but it is that, you know, if you come to our country and you were a victim of this particular incident or this particular circumstance, I should say, you know, we are attempting to offer you the ability to purchase on the insurance, on the exchange.
Okay. Terrific. Thank you. Thank you. I have a comment, a contribution from a participant that perhaps we can look into regarding DACA folks, indicating and clarifying for us that DACA folks do receive a Social Security number. So I think that's an important issue for us to make sure that we look at. DACA receives work authorization, which is different from a social, another person indicates. So it looks to me like certainly we want to make sure that we look at the details of how everything applies to that part of the population.
Yeah, it could be a tax identification number because there are a couple different classifications of tax identification numbers, so that it could be a version of that. But we can definitely look into it and try to find some answers about how that works.
Right,
yeah.
And I understand that that particular number, as opposed to a Social Security number, is given for the purposes of being able to file taxes.
Right.
Understood. Very good. Okay, this is terrific. Very, very, excellent questions. If you have any other questions, please let us know. Type it into the chat box, and while anyone takes the opportunity to do that, I do want to let you know that the quality of the programming that we offer is really important to us. And for that reason, I'm going to let you know that we are going to post a link for a very short survey that I really want to ask, request, and even beg for our participants to use to give us feedback. One of our participants by the name of Quinn Tran just posted a note that says, "Hi everyone, please take a moment to complete our quick survey." And I urge you to click on this link and give us your feedback regarding the usability and how today's webinar may or may not have been helpful to you. We really appreciate this information. It's very important for us to be able to make sure that we provide the best quality programming moving along. So I'll give a moment again. Are there any other questions? I think I have covered all of the ones that were typed so far. If I missed one, I do apologize. Okay, very good. Thank you. I think some comments and questions need to come in. One of them asked us, will Access Health Connecticut be willing to advocate for undocumented immigrants to apply for Access Health Connecticut in the future? Or would that require and need to be a change in the state policy?
Yeah, so I can answer that question.
Yeah.
There is a requirement, it is a legislative requirement that there be a change in the state of Connecticut in order for any change to be made as far as whether or not undocumented immigrants can apply on the exchange. So Access Health is always open to different policy options and always considering those policy options, especially as they enter the landscape of other states. We know that every state does it differently, and every state confronts different challenges when it comes to their populations, but it would be that they are correct that there would be a legislative change that would need to happen and be made by the state in order for us to move forward on anything like that. And it would be that the state would have to move forward on it before Access Health, I should say, could be involved in that change.
Great, thank you. Thank you so much I appreciate the answer to that question. If I don't see any more questions, I want to remind you again to click on the link that was posted on your chat box and take the 2 minutes that it will require to give us some feedback. I cannot stress enough how important it is for us to receive your feedback. The good, bad, or indifferent, we want to know, we want to provide as much quality programming by way of these webinars as possible. So we really appreciate it. And with that, I think we don't have any more questions. So I will go ahead and close the webinar, but not before I say thank you once again. Your participation is so important to Access Health Connecticut. Do fill out the survey. Let us know how it did. And any other ideas, suggestions, and opportunities to partner with you, please let us know. Thank you so much. I really appreciate it. And everyone, have a wonderful rest of your day.